Hi everyone, let's talk about glossopharyngeal neuralgia. We will start our topic with introduction. Glossopharyngeal neuralgia is a rare condition that is characterized by severe episodic pain originating from glossopharyngeal nerve, which is the ninth cranial nerve. Let's talk about its definition. Glossopharyngeal neuralgia is a chronic pain syndrome caused by irritation or compression of glossopharyngeal nerve. This nerve is responsible for sensory and motor function in throat, tongue, and ear. Now we will talk about epidemology of glossopharyngeal neuralgia. Talking about its prevalence, it is extremely rare and affects fewer than 1 in 1 lakh people in annually. So it is less prevalent than trigeminal neuralgia that is also caused by compression of trigeminal nerve. Then we will talk about age group in epidemiology, that is it most commonly occur in individuals over 40 years of age. Then we will talk about the gender. Has slightly male predominance as compared to if we talk about trigeminal neuralgia, it has slightly female predominance, but glossopharyngeal neuralgia has slightly male predominance. Now let's talk about the causes of glossopharyngeal neuralgia. The primary cause is that it is idiopathic, so it has no unidentifiable underlying cause. The secondary cause may be compression by an abnormally positioned artery or vein, or it may be compression due to tumor or lesion in brainstem or neck. Or there may be multiple sclerosis or other demyelinating conditions that demyelinate the glossopharyngeal nerve and make it a trigger point for the pain. Then there may be trauma or surgical injury to the glossopharyngeal nerve that can lead to glossopharyngeal neuralgia. Now let's talk about symptoms of glossopharyngeal neuralgia. It is characterized by pain. That pain is characterized by sudden sharp stabbing or burning pain. Episodes last from seconds to minutes and may recur multiple times a day. Pain is typically unilateral, so it affects only one side of throat, tongue, or ear. It also has triggering factor that may be swallowing, chewing, talking, coughing, or yawning, and pain may also occur spontaneously. Then it symptoms also have affected area, and that identifies which nerve decompression is it or which nerve pathology it is. So affected areas really helps to identify which area is affected or which nerve is affected. So in case of glossopharyngeal neuralgia, the affected areas are back of throat and tongue, tonsillar regions, ear, and jaw. Now let's talk about the diagnosis of glossopharyngeal neuralgia. In it, we do clinical examination that is based on its description of pain, its trigger point, and its area of pain. We can also do imaging studies to diagnose the glossopharyngeal neuralgia that may include MRI, that is to identify structural causes like tumors or vascular compression, or we can also do CT scan that may be used to assess abnormalities in the neck. Then we can also do another test that is called as local anesthetic test, that is basically application of anesthetic to the throat and that may temporarily relieve pain, confirming the diagnosis. So this is how we diagnose the glossopharyngeal neuralgia. Now let's talk about the treatment of it. We can give some medications that may be anticonvulsant that include carbamazepine or oxcarbazepine or first line treatment for glossopharyngeal neuralgia. Then we can also do antidepressant that helps to manage chronic pain, and muscle relaxant like baclofen that can use in combination. Then for the treatment we can also do surgical options. We also have surgical options that may include microvascular decompressions that relieves nerve compression by repositioning blood vessels, and we can also do gamma knife radiosurgery that delivers targeted radiation to the nerve, or we can also do nerve ablation surgery that destroys nerve fiber to block pain signals. So these are the three main surgeries that we can do or we can perform to treat the glossopharyngeal neuralgia. Then there are in treatment option there are also lifestyle adjustment, that is avoiding triggers such as extreme temperature or specific activity that may trigger the pain, and so to avoiding that trigger, to working on avoiding that trigger, even though triggers are really common, but to avoiding that trigger we can somehow control that pain. Then we will talk about prognosis. With appropriate treatment, many patients experience significant relief. but recurrence is possible and long-term management may be required to deal with the glossopharyngeal neuralgia. So this was all about glossopharyngeal neuralgia. If you like our video, don't forget to like, share, subscribe and comment. Thank you for watching.